All right, so today I thought I'd get on here and show you how to actually look at the differences between a Medicare plan and a Medicaid plan through a specific state. So, as we've already discussed, insurance companies can have different plans for different demographics. So, you can have a United Healthcare who may have a plan with for people that have group insurance, you may have a United Healthcare plan for people that have an Affordable Care Act plan. You may have a United Healthcare plan for people that have Medicare. You may have a plan for United Healthcare that is only for people that have Medicaid. So all of the insurance companies have different levels of coverage depending on what you're looking at. So there's a couple things here that I want to go over with you, and so I can show you the differences. That way you can know exactly which plan you have and not try to guess what it is. You can go on to Medicare.gov, you can go on to the different carrier websites, and they'll have that information right in there. So today I just wanted to give you an example of one of the companies that has several different plans. So we're going to use Google here. And this is all things that you can do at home yourself to get yourself familiar with how Medicare plans work and the difference between Medicare and a Medicaid plan. So we're going to look at United Healthcare specifically. All right, so United Healthcare, and I'll just choose a random zip code. So as you can see here already, health insurance plans. So we can go in here. We're going to go ahead and shop for a plan. So the first thing that's kind of a dead giveaway for us here is there's different tabs for different plans. So there's Medicare plans for people that have Medicare Part A and B. There's Medicaid plans for people that have Medicaid. There's individual and family plans. And all of these are going to be different. So Medicare, and we're going to use a zip code here in Florida for an example. Okay. So here you have a special needs plan. Okay. And here you see where Medicaid is required. So in this particular instance, you can see that United Healthcare has a Medicare Advantage plan that's in the area, but they also have a dual special needs plan that's in this area. And dual meaning this is for a person who has both Medicare and Medicaid. So even if you have Medicare, you can still have a plan with United Healthcare and it not be Medicaid related. You can also have Medicaid through the state and not have Medicare. So let's show an example of that. So here you have Medicaid. So we're going to pull up the Medicaid plans and you'll be able to know what that is because it'll say United Healthcare Community Plans. So we're going to go ahead and click on that here. and we're going to see what these plans look like. We offer Medicaid plans. You see that? So we're going to do that. We're going to go ahead and browse Medicaid plans. And you can see here where it says United Healthcare Community Plan, Medicaid. You can even go here and check your eligibility. So we're going to do that. And as you can see here, it says eligible Medicaid recipients will receive a letter with enrollment information, including information on how to enroll. Eligible recipients will have 120 days to choose a managed care plan in their region. So this is not for people with Medicare. This is for people with Medicaid, and it's a managed care organization in that particular area. So you could definitely have a United Healthcare plan, but not have Medicare. So I want you to be aware of this when you're speaking with agents or brokers over the phone or in person. So that way you are educated about what plan you actually have, and they can also understand what plan you have so that we're both speaking the same language. Because a lot of times I will speak with clients and they're not aware of what plan they have. They know that they may have, for instance, a United Healthcare plan, but they may think that they have Medicare and they actually just have Medicaid. So this is a great way to get yourself familiar with the different types of plans so that way you're not thinking you have something that you don't. So just to give you a little bit of more information about this, there are also individual plans for people with under age 65, health plans for individuals and families under age 65. These are the plans, the Affordable Care Act plans. So as you can see with United Healthcare specifically, and in the state of Florida specifically, they have three different types of plans that they offer to individuals. So you can be a person who just has Medicaid, you can be a person who does not have Medicaid at all and is under the age of 65, or you can be a person who has Medicare and also have Medicaid as well and be over the age of 65 and still have a plan with United Healthcare. But you have to have Medicaid here with the state of Florida to qualify for this plan. Just like here, you have to have an actual chronic condition such as diabetes or heart conditions to qualify. And inside here, in your summary of benefits, it will tell you exactly what level of Medicaid you need. So let's look at an example of that. And this is all public information. You can go right on United Healthcare's website and pull it right on up. You can Google it. But here you go to your plan documents. And as you can see here, there's the summary of benefits. And if you click on that, you can look right through it. And I'll show you exactly where it tells you which level of Medicaid you need to have to qualify for this. So it's usually right towards the end. Okay, so it'll tell you right here about this plan. Of course, what type of plan it is, what you must have in order to qualify. This is a dual eligible special needs plan. And it says right here, you can enroll in this plan if you are in one of these Medicaid categories. So you have to, for this specific plan, you have to be a qualified Medicare beneficiary plus, meaning you get Medicaid coverage of Medicare cost share and also eligible for full Medicaid benefits. Medicaid pays your Part A and B premiums. Wow. Your deductibles, your coinsurance, and your copayment amounts for Medicare covered services. You pay nothing except for Part D prescription copays if applicable. And you may have that covered as well if you have low income subsidy. You have to be a level of specified low income Medicare beneficiary plus, which means Medicaid pays just your Part B premium and you still get your full Medicaid benefits. You're eligible for full Medicaid benefits. At the times, you may also be eligible for limited assistance from your state Medicaid agency in paying your Medicare cost share amounts. Generally, your cost share is 0%. So just a few examples of plans that you may be eligible for that are in your state, but however are are all different plans with the same company. So hope this helped and we'll get back into the video.